able to present to you and for you to witness the significant efforts being made to enhance the experiences and outcomes of breast cancer patients here in Bermuda. And I want to acknowledge the Bermuda Hospitals Board and Bermuda Cancer and Health Center, who have worked closely with other clinicians and patients to achieve this magnificent milestone. Thank you to the Bermuda Hospitals Board, the Deputy CEO Scott Pearman, and Dr. Chris Foster, the Medical Director and Radiation Oncologist at Bermuda Cancer and Health Center, who joined me today on the podium. This initiative is part of a broader initiative led by the Bermuda Hospitals Board to create an integrated approach to improving hospital services in collaboration with community providers, charities, and patients. The bigger picture of integration involves making our healthcare system work together more efficiently for patients. This includes improving access to necessary services, making them available closer to home when appropriate, and enhancing coordination between different services and agencies. I'm thrilled to have witnessed the progress being made in integrating cancer care pathways, including the remarkable work done by organizations and cancer patients to improve the experience and outcome for people in Bermuda. The breast cancer care pathway is the first of many integrated cancer care pathways that will be improved, and Mr. Pearman and Dr. Foster will speak to you that in a few moments. Breast cancer represents the most common cancer diagnosed in women in Bermuda and accounting for 17% of all cancer diagnoses here on island. And the new pathway for breast cancer care is a significant step towards improving care for various types of cancers. And I'm excited to see the fruits of the many individuals, the groups, and the organizations who have put in a lot of hard work to get us to where we are right now. Together, we can achieve far more than we can individually. And there is an excellent opportunity to make improvements that prioritize the people in Bermuda. And I want to express my gratitude to all of those who have been involved in this very critical work. And I anticipate witnessing continued progress and improvements in cancer care here in Bermuda to benefit all of our citizens. Thank you. I'd like to now introduce to you the Deputy CEO of the Bermuda Hospitals Board, Mr. Scott Pearman.
Thank you, Minister Wilson. I would like to first extend my appreciation to Minister Wilson for sponsoring an August 2020 cabinet paper on healthcare reform, which came with the request that the BHB take a lead in developing the methodology for integrated care pathways. BHB's role in developing the integrated care pathway was to use our position in the health system to sponsor the pathway mapping process collaboratively with other stakeholders and, most importantly, patients. We have been very pleased to partner with the Bermuda Cancer and Health Center on the development of cancer pathways along with other local agencies, clinicians, and providers, as well as cancer patients. With us today is Dr. Anna Nielsen-Williams, Chief of Psychiatry at MWI, who is the physician lead for the integration program and has provided mental health input into the development of the care pathways. The process for the breast cancer pathway improvements has been to understand all of the critical touch points for the management of a breast cancer diagnosis and listen to all those involved as we develop ways to make it more coordinated, efficient, and supportive of patients. Today, I am very pleased to give Minister Wilson a booklet with information about breast health, breast cancer care in Bermuda, what the pathway looks like, and how the different organizations and providers work together. This document is available to the entire community at bermudahospitals.bm or bchc.bm. The information in it is based on very complex service and journey maps, all developed as part of the pathway process. I'm going to hand it over to Dr. Chris Foster to talk in more detail about the process and improvements that we are already seeing. Going forward, as we build an improved healthcare system, we want to encourage patient and stakeholder participation in planning and improving services across Bermuda. As the breast cancer pathway shows, it helps us to improve quality, experience, and outcomes for patients while reducing inefficiencies, minimizing delays, and reducing overall health system cost. And now I'd like to introduce the Medical Director for Bermuda Cancer and Health Center, Dr. Chris Fosker.
So thank you to Mr. Scott Pearman on behalf of BHB, firstly for the introduction, and secondly for delivering the booklet this morning to Minister Wilson. And also thank you, more importantly, for the support for the last 2 years from both in terms of this integrated project. As Mr. Pearman has articulated, the idea is looking at how we integrate the service that we have to improve the patient experience and the patient outcome. And when we've looked at that from a cancer perspective, what we've looked at first is the breast cancer pathway, but we have looked at prostate cancer, colorectal cancer, acute oncology. And what we're looking for is transferable change that we can apply to all parts of the pathway. But the real key has been the stakeholder engagement. So the process has been getting in the stakeholders, doing really detailed interviews to find out what the experience is. And of course, the most important stakeholder is the patient. And what we found is we got really, really valuable information by doing interviews with patients who've been through the pathway. So they've understood what happens, not just what happens, so not the questions about going from A to B to C, but the question about how you felt, who you spoke to, what did you want to know, what was difficult. And so by integrating all of those elements, and particularly by integrating it into breast cancer, where we have all the key parts of the pathway here on island, we have exceptionally good diagnostic care with equal access, we have wonderful surgeons, good oncologists, and good support all the way through. So we're not looking to bring in big change. What we're looking for is that integration, that communication, that improving in efficiency. And I feel I should emphasize, this has been going on for a couple of years, and it's part of a continuous quality improvement program. So this isn't a finished product. These are little signposts along the way about how well we're doing with the delivery today of the booklet that has got the patient in mind, and the pathways that help the stakeholders and the patients as well. Because what we really heard from the patients is that the care is good, but there was trouble points, stop points along the way where they didn't understand what should be happening next. They didn't know how long it should take. They didn't know who they should be talking to. And those are the improvements that we've brought in already. So with breast cancer, about a year ago, we started what's called a multidisciplinary team clinic. So each week we have the pathologists, the radiologists, the oncologists, the surgeons, the nurses, the cancer navigators all sit down together to discuss each new diagnosis of cancer, of breast cancer, to make sure that we're all on the same page, that we're all agreeing what's the right thing to do. And then following that, we then have a newly diagnosed rapid cancer, breast cancer clinic, where the surgeon, so Dr. Tuitt, is coming to Bermuda Cancer and Health and seeing the patients in that setting. So they then know who they're going to be seeing when, who they're going to be seeing next, who they need to talk to, so they're getting those communications. As a part of that, we've also introduced Cancer Navigator at Bermuda Cancer and Health, and a cancer coordinator is coming through in the hospital. Again, working your way through the pathway, being able to visualize the pathway, either by the documents provided or from the patient perspective, looking at the breast cancer booklet, is the real key important in terms of how we can improve the patient experience. And by improving the patient experience, improving the outcomes and making everyone feel much more comfortable having their care here in Bermuda, knowing that they're getting exceptional care here on island. So overall, again, having thanked the two here, really need to thank the patients, because they're the key people who've made this happen, who've made the changes, who've opened our eyes. You know, we could see a cancer pathway that had 5 spots on it. And then if you look at the pathways that produce, there's hundreds of little steps all the way along that get really, really complicated. And it was that patient experience that really educated us in terms of what we needed to change to improve the experience. So thank you.
Thank you. We'll now take some questions from the Royal Gazette. Eric?
Thank you. Dr. Fosker, if I could just ask you, you talked about improved outcomes. Do you have any statistics to bear that out? Is life expectancy increased or cure rates up or anything like that?
So it's too early to look at those outcomes. Those are naturally the outcomes that people want to know about, but they take years for us to be able to change. Mm-hmm. One thing we can say on that front is that we are now prospectively, so upfront, collecting all of that data so we can really talk about what happens in Bermuda and how well people do. Due to be published either later this month or next month is the National Cancer Control Plan Phase 2, and that has a lot of those details. What we've really focused on with the integrated pathway is time, So what we were able to demonstrate when we looked at the breast cancer pathway is that for some ladies working their way through, it was taking too long to go from the biopsy to get the diagnosis to the treatment. And again, we're collecting data, too early to kind of give statistics, but we can clearly see that there is a significant improvement in how quickly ladies are going from that first concern, whether that's a mammogram or a lump, getting their diagnosis, get the information that they need, and then starting their treatment pathway.
Right. So it's a given that there will be improved outcomes
Yes.
if they're getting treated
Yes.
sooner.
Yes.
Sure.
Time is a really simple thing to measure, and we're able to demonstrate that's an area that we can improve, and it has been shown that just by speeding up the pathway, you will improve both experience and outcome.
Okay. And where are you thinking about expanding this program to this integrated approach to other cancers? You mentioned prostate. Are there priority cancers that you're going to be focusing on?
So I wouldn't call them priorities, because for every patient, the cancer they've got is the priority.
Sure.
So we chose to look at breast cancer first because we could see that the pathway was complete. We then looked at prostate cancer and then colorectal cancer. What we were trying to do with those and what we've been able to show is you're looking for transferable change that works for every cancer. So some of the things we found out from breast cancer, prostate cancer, colorectal cancer, and then we're also looking at acute oncology. We can then see that that's going to be impactful for lung cancer or impactful for brain cancer. So we're looking at those changes and making sure that they can be implemented whatever cancer you've got.
Okay, Doctor, thank you so much.
Thank you.
Thank you.
Thank you. Are there any parting words that you'd like to leave before we end? Any final thoughts?
Yes. Thank you again to BHB as well as the Bermuda Cancer and Health. This is an incredible initiative, and I'm so thrilled to be able to be a part of this. And I encourage everyone to upload the, oh, you didn't show it, Scott.
Just under there.
Oh, okay. Upload this, download it, whatever, get access to it because it has some incredibly valuable information for women and their families who are journeying this particular cancer pathway. So thank you all for joining us. This is really incredible, and I'm very happy to be able to be a part of it. Have a good day.
Thank you. That concludes today's press conference.